I am Sujata Barakuti.
I am Jamna Bali.
And today we are here to present a short Microsoft PowerPoint presentation, teaching session, which is also a part of our assignment on the topic of CAUTI, its prevalence rates, and the national and international guidelines. So today we both have tried our best to present on this topic. So here we go. So in our course outline, we have introduction of catheter-associated urinary tract infections, and we have tried to mention a few common microorganisms causing CAUTI. We have factors contributing towards hospital-acquired infection and CAUTI. We have mentioned about the complication of long-term catheterization and the prevalence rate of infectious disease in New Zealand. Likewise, we have mentioned evidence-based measures to prevent CAUTI and the general measures to prevent hospital-acquired infections. Along with this, we have just tried to explain about infection control management shortly, along with the evidence-based standard and guideline used for prevention and control in New Zealand. And our last part is the contribution of IPC standard and guideline. So as our first part of introduction, we have catheter-associated urinary tract infections as our main part, and it is the most prevalent health infection, most frequently used in urinary obstacles, and incontinence is almost invariable in all patients within 14 days of the catheterization. That improves morbidity, mortality, and the therapy cost in critically ill patients with long-term indwelling.
3.
So talking about the common microorganism causing CAUTI, CAUTI in patient with short-term catheter is usually caused by single microorganism, but among the variety of microorganism, E. coli is the most frequent species that is isolated as a causative agent, and beside E. coli, other Enterobacteriaceae like Klebsiella, Serratia, Citrobacter, Enterobacter, along with the Pseudomonas, gram-positive cocci, cons, and Enterococcus. The complications of long-term catheterization are lower and upper catheter-associated urinary tract infection, which is the most common. Besides this, bacteremia is also one of the complications. Sometimes renal and bladder stone formation can be seen. Besides this, catheter obstruction and universal bacteria, and last is sometimes persons are getting even bladder cancer. So the prevalence rate of infectious disease in New Zealand can be shown in a bar graph, which was observed at Toyohamani Institute of Technology in the country. So this bar graph expresses the graphical representation with the basis of acquired infection in the department of chemotherapy. So from the figure, from the graph, we can see that the prevalence rate of LRTI is 51%, like that of UTI is 22%, and cellulitis is 18%. Besides this, influenza-like illness and other infectious rates are below the 5%.
Evidence-based measure to prevent CAUTI. Overuse of indwelling urinary catheter, 15 to 20% of hospitalized patients that contribute to frequency of hospital-associated UTI, and the duration of urinary catheter is the most important risk factor for developing CAUTI. Urinary catheters are commonly placed for inappropriate indications and healthcare providers, and often unaware that the patient have catheter leading to long unnecessary use. Evidence-based measures to prevent CAUTI associated. Evidence-based measure to prevent CAUTI recommends inappropriate catheter use, antiseptic insertion, use of closed drainage system, education awareness campaign, and periodic service education to healthcare workers, proper maintenance and timely removal of catheter, the use of established practice such as These are the 5 moments of hand hygiene: lathering, scrubbing, spreading, washing and rinsing that play the vital roles to prevent hospital-acquired infections. Hygiene approach recommends to healthcare workers to clean their hands. Number 1, before touching the patient. Number 2, before cleaning and antiseptic procedure. After exposure to the body fluids. After touching the patient and after touching the patient surrounding. General measures to prevent hospital-acquired infection. Good hygiene practice including hand washing, environmental cleanliness, personal hygiene should be maintained. Safe handling and disposal of staff contaminated instruments. Appropriate waste handling, reprocessing and reusable instrument and equipment. Protective isolation for immunocompromised patients to reduce the chance of opportunistic infections. Use of sterilization gloves, gown, which are safe for touching contaminated instruments or other infectious materials. Wear a mask and eye protection to protect mucous membrane of eyes, nose and mouth. Vaccination of healthcare professionals and healthy practice of antibiotics. Talking about infection control management, it is subjected to the crucial issue of providing the medical safety for the healthcare workers against commonly occurring the infections. Infection control management basically ensures that the healthcare protection against the probability of cross-infection. These are the evidence-based standards and guidelines used for prevention and control in New Zealand. That includes minimizing the close contact of the infected people, avoiding their droplet infection like coughing and sneezing. It is instructed by Ministry of Health of New Zealand not to split in public places. Use of disposable tissues and besides that, evidence-based standards and guidelines to prevent and control infection in globally. WHO suggested to wear gloves, masks to prevent the microorganism pest disease, and they suggested airborne precaution also and droplet precaution and contact precaution. Overall, IPC standard and guidelines contributed providing a healthy framework to support the performance of good practices, high quality and people-centered health services and progression towards the universal health coverage, contributed in achieving the United Nations Sustainable Development Goals for the children and women health, addresses the development implementation of technical guidelines, emphasizes the importance of local adaptation, and addresses the needs for training of all staffs in IPC measures. Thus, from this teaching session, we can conclude that CAUTI prevalence rate can be minimized from the implementation of standard guidelines.
So we are here at the end of our session. Thank you very much for watching our video. We tried our best to explain about CAUTI, the prevalence rate, the international and national guidelines. So I hope you liked our video, and thank you very much.